Okay. And it is. Please also read the role player's notes, please, doctors. The role player scenario will help you to be more comfortable because you will be aware of the dialogue which will happen between you and the role player. No surprises, you'll be more confident in the station. So please read the scenario and rapidly have a look at the role player's notes. We'll start
Oh,
after 2 minutes.
I thought it was child ADHD. I didn't I read the child ADHD. I prepared the child
Okay,
ADHD.
okay, I will pick up. Okay, no.
Okay, thank you.
Maybe I thought I you have 2 minutes.
Okay.
Ready?
Yes.
Okay.
What's the mom's name?
Let's say that her name is Mrs. White, and
White.
please raise your voice because it's not very obvious. Okay?
Okay. Can you hear me now?
Yeah, yeah.
Okay.
Okay, so I will set the timer now. We
Okay.
will start with a few seconds.
Okay.
Go.
Hello, Mrs. White. I'm Dr. Yusuf, one of the psychiatrists with the mental health team here. I understand you had some concerns about your son Ruben that you would like to discuss.
Yeah. Thank you that you are here to talk with me. I'm very happy. I would like to know more about what's going on with Robin.
Yes, definitely. I'm here to help you. From our discussions, it appears that Ruben has a condition called ADHD. Have you heard about it?
No, what is it?
So ADHD is short for attention deficit hyperactivity disorder. That's a neurodevelopmental disorder that's more common among boys compared to girls. It's 3 times more common in boys, and it usually starts before the age of 7. It's characterized by hyperactivity, making the child really difficult to manage their behavior, and also inattention affecting their education, and impulsivity putting the child in risk. Is it clear so
Yeah,
far?
yeah. So is this problem common?
So the general statistics are 1 in 20 children have a diagnosis of ADHD. It's about 3.5% among boys and less than 1% among girls.
Well, his father also has ADHD and I'm now 8 weeks pregnant, what
Hmm.
are the chances of having a baby with this disorder?
That's really good question. So ADHD is a disorder that runs in families, and having a family member with ADHD increases the risk of having ADHD. So about three in every four children have a family member with ADHD as well. And also having a sibling with ADHD increases the child's risk by 30%.
I see, I see. So what are the causes of ADHD?
Mm. So there are no definitive causes. However, there are some factors that increases the risk of ADHD. These factors are, for example, smoking and drinking during pregnancy, having a traumatic head injury, getting exposed to some toxins during pregnancy, like lead, and also preterm delivery and low weight at birth.
I see. Are there any blood tests to diagnose it?
No, so ADHD is diagnosed by a clinical assessment, and there are no blood tests that could definitively tell us about the diagnosis of ADHD.
So, will you feel that he is going to get better?
I can see you're quite concerned about Ruben. However, before I answer that question, would it be all right to ask you a few questions?
Okay, no problem.
So, how's the family? How's the environment at home, and how's the family
Well,
coping?
everything is fine.
Right. Is there anyone supporting you to look after Ruben?
Yeah,
It must
yeah,
be
my
very
husband,
difficult.
my stepmother, and also my mother.
Okay, good to hear that. What about physical, the physical health issues? Does Ruben have
He
any
doesn't
physical?
have any physical problems.
Okay, and just one last question. Have you noticed any risky behavior? Does Ruben like run into the road, or are you worried about his safety?
Yeah, yeah, sometimes. Yeah, yeah. He just does things suddenly.
Okay, okay, that's probably must be very scary for you. So thank you so much for telling me this information. So from what you just told me, it appears that Ruben has ADHD, and this is affecting his education, and there is a considerable risk if this is not managed well. All of this on the background that there is no physical health issue or other psychiatric issues, but however, there is a family history and that his dad has ADHD. Is that correct?
Yeah, 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 no problem. So, well, how are you going to help him then?
In terms of how we're going to help him, I would first start that with Ruben. Ruben will have regular follow-ups in the child and adolescents clinic, and I would like to order some investigations, mainly full blood count, kidney function test, liver function test, and most importantly, his weight and height. After this, Ruben will have a multidisciplinary team looking after all of his psychological, physical, and social needs.
Okay.
Yeah, so after we make sure everything is well and physical health of Ruben is fit and well for medication, the main medication and the backbone of treatment of ADHD is a medication called methylphenidate, which is a stimulant. Have you heard about?
He is already stimulated, doctor. 1 minute remaining.
Okay, so I understand where you're coming from, and this might be confusing. However, um, methylphenidate works by balancing brain chemicals, especially the front area, which it appears that it's underactive in people with ADHD. So that's how methylphenidate is going to help.
Any side effects?
So, as any medication, methylphenidate also have side effects. The main side effects are stomach upset, sleep issues, and also it might affect his growth. However, Ruben will be monitored closely to manage all these side effects.
Does it affect the liver?
So there are other medications for ADHD that affect the liver, but methylphenidate does not affect the liver.
Okay, doctor. Anything else could be helpful?
So having a psychoeducation for the family and supporting the family would be very helpful.
Time. How do you feel about what you did? It was good, but you have the tendency to talk. Unfortunately, you lost time. It's very important in this station to talk about the social part of the intervention, the family psychoeducation, as well as contacting the school special education coordinator. Very important, doctor. If you want to show yourself different and distinguished from the other candidates, you must mention these 2 points. That the family is also involved in the management. They must know how to deal with this child and what are his needs. And definitely they need a support, psychological support. And also the school should understand his condition. Okay, very important. As I've heard that sometimes the patient is referred to you primarily because he is being complained from his school. So very important to do this. Unfortunately, I feel that you know it, but you wasted time in the way you talk, and this is the most common of time lost. Sometimes the candidates either they stutter. We know that you know this type of talking. You only have 7 minutes. If you lost 1 to 2 seconds in every sentence, at the end of the station, you will feel that you need 20 to 30 seconds, which you have lost in the way of talking. So please pay attention to this. Everything was okay in your performance. I don't have any comments except that you should show empathy. As we said before, this is a test of your skills and also competency. If you have a mother who is worried about her child, show empathy, show that you understand her worries and you are here to help her. Very important to do this. Don't be very technical and robotic in your approach. It's not about talking about the medications and sending the patient here and there and family psychoeducation. Show your communication skills. In every mark sheet, half of the score is on the communication skills. Again, on every mark sheet, half of the score is on your communication skills. Don't forget this. Don't forget this. Most of the candidates don't pay attention to this, and they find themselves that they think that they did well, but they lost their communication. Okay, all what they are focusing on is the medication and putting the patient in the hospital, getting him out of the hospital, giving him the depot, etc. And they forget that there is some sort of emotional reciprocal interaction which they should demonstrate. But all in all, you are empathetic, but in the very first beginning, show that you are empathy. Tell her that I can see how much you are worried, and rest assured that I'll be here to address all your questions. Say anything in the very first beginning after your introduction to show that you have the same emotional tone like her. Okay, let's go through the notes. As you can see, the role players note the role player is instructed to show that she has been struggling. No, not this one. Sorry. Okay. Please pay attention here. The role player is instructed to show that he or she is very concerned And this is not for nothing. They want to see if the candidate is able to pay attention to this type of communication and what is required in this situation regarding his or her communication skills. Okay, pay attention to this. Okay.
Okay.
Do you hear me? Do you all hear me properly?
Yes, I can hear you.
Okay. So let's go through the items of the management. As we said, you have only 7 minutes. You must be very organized in your approach. First thing is to do your introduction. Then you might or you might not gather the biopsychosocial notes according to the station. Then you must do your explanation and then do your formulation and finally the management. So these are the 5 steps which you should go through in your performance to make sure that you are going to score for yourself the points of the mark sheet. Regarding introduction was very good, no comment, but pay attention, you should show empathy in very early stage, in the very early stage of the station. You explained everything very well. I don't have any comment on the questions which you are going to have. Just please, which I post you, but pay attention, please, Candice, because this information is not present in the other notes. Because in the station, the mother will say to you that his father is having ADHD and I'm 8 weeks pregnant, and she wants to know the chances of having a baby with this ADHD. So I did my own research and I come up with this type of answer. So if you want to have a screenshot, just feel free to do this. You will not find this question to be answered properly in any other notes. So the ADHD is a disorder which runs in families. So if we have 4 children who have ADHD, 3 of them will have a family member who have ADHD. Roughly speaking, anywhere between 1/3 to 1/2 of parents with ADHD will have a child with a disorder. If an older sibling has this ADHD, the next child has more than 30% chance. So it's around between 30 to 50% chance of having a child with ADHD. Okay. Now pay attention to the following. I asked you if how is he going to get better, and you gathered the right information to answer this question, but instead of answer the prognostic factors, I asked you if he's going to get better to see if you understand what are the prognostic factors, but instead of saying the prognostic factors, you said the formulation. Yes, you said the formulation right, but you did not answer my question. Is he going to get better or no? You gathered the information and then you did your formulation. The management is very important. It is very important to go through the management in an organized way, because when you start talking about the management, you will only have around 60 to 90 seconds. I don't think anyone can have more than this when he starts to talk about how he's going to help this child. So you must be very organized. The first step is where the patient is going to be treated and what Dr. Nima is going to do. This is very important because it will show that you know quite well how to treat the patient, because some patients need to be stayed in the hospital, some patients need to be followed up in a child and adolescent clinic, other patients need to be in a memory clinic. So this is part of the management. Okay, and what are you going to do? Are you just going to send him here and there, or you want to see the patient by yourself in your clinic, which is here the child and adolescent clinic? Okay, very important to say where the patient is going to be treated and what are you going to do. As long as in the that there are medications in the management, very important to talk about the investigations. Never give a medication without having the appropriate set of investigations. And here we have a commonly used set of investigations, but don't say blood tests without elaborating more that you want to do complete blood count, liver function test, kidney function test, chemistry. And here it is very important to record the child's weight and height. And this is an important point which some candidates forget. or actually many candidates. Okay. So there will be a child and adolescent team. Very important to say this sacred sentence. The team who will follow up the patient. Sometimes there are specific teams. Here we have the child and adolescent team. Sometimes there are substance misuse team. Sometimes the maternity team. So here we have this team, and it is very important to say this sentence. A team who will follow up all his needs physically, psychologically, and socially to show the consultant that when you manage the patient, you are considering all his aspects and you are approaching the patient in a holistic way, not only giving medications. There are psychological and social issues which you should pay attention to, and physical also, okay? Here the backbone is the stimulant. You answered this question very well. Does it affect the liver? It is a common question. The methylphenidate does not affect the liver, but there is another medication called Strattera, which has been linked to liver problems. However, Robin will be closely monitored after the start of the medications to make sure that he will be safe. A very common question is, in this station, you will be asked if there is any special diet. This question is difficult, and again, you will not find the answer anywhere else. Please take a screenshot. There is no definitive ADHD diet. However, adopting a healthy eating habits is the best way to elevate his mental and physical wellness. Increasing the intake of fruits, vegetables, whole grains, and healthy proteins, while limiting sugar, refined carbs, and saturated fats. Okay. Now, very important in this station to talk about the social approach. As I said, you will not, from my perspective, no candidate will pass this station without talking about the family psychoeducation and the communication with the school, because this is a child with special needs. So the family should understand what are the special needs, and also the school should understand his needs. If you just talk about the medications, I don't think that you understand the needs of this child, actually. As a consultant, I will not pass here. Okay. So very important to talk about the social approach, which is the family psychoeducation and the communication with the school special education coordination. Physically, you should liaise with the GP to explain the condition of Robin and the possible side effects of the medications, okay? So let's go through the mark sheet. As you can see, this mark sheet is composed of 12 points, and 6 of these 12 points are about your communications. And most of the candidates don't pay attention to this. They think that all what is required from them is talk about the management and the technical points. The exam is called competency. Just check what is the meaning of competency. It is your communication. Are you able to address the role players' emotional state, and you should elaborate a reciprocal appropriate emotional state or no? Okay, pay attention to this while you are revising. Pay attention to your communication. So, yes, Dr. Nima did formulate the problem effectively, and I don't think that this is a common skill among the candidates. Most of the candidates don't know how to formulate, though, as you can see, this is the first point to be scored for you. And I have shared before, I don't know, this was about maybe 1 year ago, an article in which the consultants have been interviewed, and they were asked why the candidates fail in the management stations. And most of them said that they are not able to formulate the problem. Okay, when you formulate the problem, this means that you understand what is the problem and you are able to crystallize it and say what is the problem in 2 to 3 or 4 sentences maximum. Fails to recognize the significance of finding the results. You did recognize them. You had a management plan, unfortunately, did not talk about this, the social part. Does not pay sufficient attention to the patient physical health. You said, I'm going to see the patient. When she says, I'm going to see the patient, address his concern or follow him up in the clinic, this means that you are going to score for yourself this point. That's why it's very important to say this sacred, also another sacred sentence in the management. I will see the patient myself in the clinic and I will address his concern. I will follow up the management plan. Just say that you are interested in your patient, okay? Does not pay sufficient attention to the patient's as a physical view. You did, and this point is going to be scored for you. Adequate management plan, again, the psychological social part, which is important. You did not talk about it, so this point is not going to be scored. Does not identify appropriate psychological social interventions. Unfortunately, again, this point was not scored. So though she told in details about the medications, unfortunately, she will not score in the management except 3 points. Regarding the communication, everything in her communication is good. Again, this is not a pass or fail assessment. I'm just trying to help you to understand how you are assessed and what are the points to be covered while you are doing your performance, okay? You must understand what they are expecting from you, and this mark sheet makes it quite clear. And unfortunately, some candidates even revise without using this mark sheet. Actually, see horrible things, actually. Okay, so let's go to the next candidates. Thank you so much, Dr. Nima. I hope that you found
Thank
it.
you.
So who would like to go next?
Thank you.
Who would like to go next?
I can go next, doctor.
Dr. Summer. Okay.
Yes.
So what is your station?
Refeeding syndrome.
Okay. Yeah, okay.
Okay, I'm ready.
Excellent. So let's say that the girl's name is Anna. Okay, and I'm the nurse. Let's say that my name is Margaret. Okay, no.
The nurse Margaret and the patient Anna. Is it
Okay, yeah.
correct?
Yes, yes.
Okay,
Okay.
okay.
1, 2, 3, go.
Hello, Margaret. I'm Dr. Summer from the Mental Health Unit. I understand from the notes that you have some concerns about your patient Anna. Is it correct?
Yes, yes, I'm very worried about her because she has not been well for the past week. Well, terribly unwell, though she has been doing fine. And I want to discuss with you to know how we are going to help her.
Okay, at the beginning, I want to thank you for your deep care of your patient and also about your wise decision of raising these concerns. So I need to ask you a few questions to make sure I have the whole picture here. Is it
Okay,
okay?
okay.
So what did you notice about her physical condition, about Anna condition?
Well, I've noticed that though she has been gaining weight, 2 kilograms per week, but um, she is not well. Her hand and feet are swollen, and
Mm-hmm.
also she is not able to, uh, grind the food, and she feels so weak she can hardly move.
Okay, that seems so hard, yeah.
Yeah,
And what about her vital signs? Did you take her blood pressure, pulse, what
everything.
so?
Well, the blood pressure is about 95 and
Mm,
60 over 60. The blood tests
okay.
done, everything is okay except that she has low phosphate.
Okay, and she is taking any medication now?
No, no, that she doesn't take any medication.
So there is no underlying medical disorder at all?
No, no.
Okay. Did she have any investigation recently?
Yeah, I said the blood test, everything's okay except phosphates. low phosphate.
Oh, except phosphate. Yeah, okay, thank you for that. And how about her mental health? Did you notice any psychotic symptoms or
She has
depressive
been
symptoms?
diagnosed with anorexia,
Mm.
and that's all what I know about her. Nobody informed me about anything else.
Okay, and she is following with a dietitian
No,
or not? No. Okay, and what about her social support? Do you think her
she
family is
has a
supportive for
very,
her?
very very supportive mother. Actually, she lives only with.
Mm-hmm. I can't hear you, sorry.
She is living with her mother.
Okay. So how do you describe her mother?
Her mother is very caring and very supportive, and she is asking to help her to gain weight.
Okay, okay. The sound is not so good. I'm sorry for that. So do you have any concerns about her safety you want to share with me?
No, just only her medical problem and medical condition, which I would like to share with you. That's it.
Okay, okay, thank you for that. So, from our discussion, I think what's going on with Anna is what we call refeeding syndrome. Have you ever heard about that?
No, what is this refeeding syndrome?
So it's a critical medical condition that happen when the body is used to using the fat and it's shifting from using fat into carbohydrate very fast, as in the case of anorexia nervosa and also in starvation. And this will lead to some chemical changes in blood, like a falling of phosphate, magnesium, and potassium, and also in weakness of the muscles, like the heart muscle, the swelling muscle, and this will lead finally at some kidney dysfunctions and also falling the blood pressure. Does it make any sense with you?
Yes, yes, yes. So I'm just wondering. So, uh, well, how are you going to help her then?
Okay, that's before we going into the management plan, I want to highlight only the important points we have discussed for today. So Anna, she has anorexia nervosa diagnosis, and now she has a refeeding syndrome. Her condition is not very stable. There is some concerns about her, and it can be very risky if not managed properly. And all of this on the background of having no physical disorders, no psychological problems, and she's not following a diet plan with a dietitian. And her family also need to understand more about this condition and how to treat it properly. Okay,
Okay.
is it okay with you?
Yeah, yeah, yeah.
Now we are talking about now we are talking about the management plan for Anna. So at first, it's a critical condition. It cannot be treated at home. So we need to take her to the medical emergency as soon as possible. And there will be she will be examined by the physician, and we will do some investigation to make sure that her physical health is all right, like blood electrolyte, kidney function, liver function test, and heart tracing. Are you following so far?
Yeah, yeah, yeah.
Mm. So the backbone here is to make sure that the vital function is already is corrected gradually, and the electrolyte imbalance is also corrected, and we will give her some vitamins like thiamine. And then we will there will be a team which will cover all her needs socially, physically, and psychologically. Are you following so far?
Yes, yes, yes.
Okay, so at first I will discuss her condition with the GB after showing her investigation result. And then we will make sure that she's following with a dietitian to make sure that she's not gaining more than half kilogram per week. And we will teach her family how to take care of her properly and more about this condition.
One
And
minute remaining.
of course we will follow her regular basis physically and socially and psychologically to make sure there is no risky any risky physical symptoms that appear, and also to manage her psychologically, and we will help her family to understand the anorexia nervosa condition and how to treat her properly. Do you
Do,
have any other concerns
do
about
you feel
her?
do you feel she's going to be better?
Yeah, yeah. If she is managed very properly, of course, she will get better. And the good news here is that you have noticed her condition very early, and you have raised your concerns about her. And if she is managed properly, she will be very okay. Do you have any other concerns about her?
No, thank you.
Thank you for talking to me.
Sometimes. How do you feel about what you did? It was good, very
I
good,
tried to, I,
except that
yeah,
you missed to take care of. Um, yeah, you should say that if the patient is using fat as a source of energy for a long time, we all use fat as a source of energy from time to time, but for those who are starving or in anorexia, they are using the fat as a source of energy for a long time, very long time, and this causes
okay, yeah.
marked chemical changes which should be changed gradually, not suddenly. Okay,
Yeah,
please,
yeah, understand this.
please, doctor, as we always said, there are some sacred sentences in when you talk about the management. One of them, I will see the patient myself because there is a point in the mark sheet for those who are paying attention to their patients. So you must say that
Okay,
when she goes to the hospital, I will see her myself. I will discuss her condition with her, and also I will discuss the condition with the physician. So you must see your patient to explain to her what's going on, and also have a discussion with the physician. Are you following me? Um, Prognostic factors, please. When you will always encounter this question: is he or he is going to get better? And this is a very common question, and it has a standard answer. So if the patient, there are some factors which helps the good outcome of the management, like being early treated. She doesn't have any previous medical problems. She is cooperative and she doesn't have any stresses. All these factors help the patient to be uh, in the course of a good outcome. Okay. The prognostic factors, I think I've shared it before on my YouTube channel. But when you have this question about if she going to get better, yes, you answered quite well, but there are some factors which should be added. For example, if she's cooperative, as we said, she doesn't have any medical problems. She have a support around her. All these put in the good outcome. She doesn't have any comorbid psychological problems which can hold or make the management problematic. All these pour in the good outcome. Okay, so let's go through the notes. Okay. Bismillah. The introduction was very good. You are talking with a caregiver who has been with the patient and she understands her condition. She has important information, and at the same time, she is giving medical service. When you are talking with someone like this, you need to do a handover in the very first beginning. You must have a handover and show that you are professional, and you must say, I will take a handover, because this is the professional way in communicating with your colleague who has been taking care of another patient, and you are now involved in the management of this patient. So you want to have some information about his biopsychosocial condition and at the same time the level of risk, which you did. But you must understand what the candidate should understand what's going on here. This is a nurse who has been following up this patient, and you don't know anything about this patient. So the first thing is to take the patient's condition and know the details in a systematic, organized way. Okay. So you ask about the physical, you ask about the psychological, social, and the level of risk. Again, please show that you are keen about your patient's safety. From my perspective, and as far as I know, any candidate who does not ask about the patient risk and safety, I don't think he will pass this the management. So I'll always ask about the risk. Always show that you are a doctor who is keen to make sure that his patient is safe. Okay, you explained the diagnosis very well, but make sure that you emphasize that this patient has been using fat as a source of energy for a long time. Okay, and this causes marked chemical imbalance, which should change gradually, not suddenly. Okay, formulation, you formulated very well. Your management was very good. don't have any problem with the management. Everything was good, except for one thing that you should see your patient. You should talk with your patient. Why is that? Why am I stressing on this point? Because I have a mark sheet in my hand. If I'm the consultant and I have a mark sheet, there are candidates who talk to their patients, are keen to explain the condition to their patients and address their concerns. And there are candidates who does not do this. They just send the patient here and there, give medications. You don't want to talk with your patients. So those who don't want to talk with the patients will not score the point number 4. You can easily score this point by saying, I will see the patient myself, address her concerns, I will discuss with her, explain to her her condition, say anything to show that you are in contact with your patient, okay? So going through this mark sheet, you formulated the problem effectively, you recognize everything, okay? Adequate management plan, very well. You did not pay sufficient attention. You didn't say that I will talk to my patient. Risk management, you did. Appropriate psychological and social interventions, very well. You talked about the dietitian and the importance of the communication, the education of the family. Your communication was very good. Everything was good in this station regarding Dr. Oscar. Very good. Okay, thank you so much, Dr. Samad. Who would like to go next? Let's see.
Doctor, please, I need to ask
I
you
would
a
like to be
question.
next.
Okay, who would like to ask any question?
Me, doctor, I want to ask you. You have mentioned from some moments that we don't have to do the biopsychosocial in each station. In some stations, yes, and some stations, no. On
Yes,
what
yes.
does depend? Depend on
According
what?
to the scenario, sometimes you don't need, but in this station, when you have a handover to be done, you must do this. Okay.
Okay.
Sometimes you have a medical student who doesn't know anything about the patient.
Mm-hmm.
Okay, like the
Okay.
myocardial infarction, post-MI depression. He is a medical
Mm-hmm.
student who wants to know more about the patient's condition, but he doesn't have any information. So what are the information you are going to gather from? Okay, so
Okay.
according to the scenario, if
Mm-hmm.
there is a caregiver, definitely you need to do a biopsychosocial.
Okay. Okay. And another question about the prognosis of the condition of the anorexia. Can you answer it again, please?
So if it is a medical problem like this problem or delirium, you must focus on the medical issues like not having a previous medical problem. She is physically clear regarding any physical problems. The condition is early detected. She is cooperative with the management. So this is how you start. And definitely, if she does not have any other psychological problems which can complicate the management and make her not cooperative, this also is better. If she has a supportive family, also this will be also a good point. As you can see, this is a common answer to any medical problem. If the problem is primarily medical, if the problem is psychological, you just say that if the patient is engaged in the treatment as soon as possible, previous or before the illness, if the patient is functioning, if he does not have any stresses, if he has a support around him, and if he doesn't have any medical problems, all this also falls in the good outcome. So as you can see, if it is a medical problem, you will talk about the medical prognostic factors in the beginning. If it's a psychological problem, you are going to talk about the psychological prognostic factors in the beginning. Okay, I hope that this is clear, and there is a some sort of
Yeah, it's clear.
YouTube
Thank you, doctor.
YouTube uh, channel. So sorry for the voice. Sometimes it is unclear. I don't know why. Just if at any time you feel that the voice is not clear, just tell me. I will raise my voice. I don't know. Okay, so who would like to go next?
Me, doctor.
Okay, so what is your station, Dr.
Post MI depression.
Yeah. Ready?
What will be the nurse name and the patient
I say
name?
that my name is Robin and the patient's name is Mr. White.
Robin and Mr. White.
Okay.
Okay.
Okay, so you start now, Dr. Yao. 1, 2, 3, go.
Good evening, Mr. Robin. My name is Dr. Yara Ihab. I am one of the mental health psychiatrists working here. I gathered from the notes that you have some concerns about Mr. White.
Yeah, I don't know, doctor. He's not very cooperative with his medical plan, though he has a health problem. I don't know why he is not involved in the rehabilitation program, and I would like to know more information about his condition and his management from you.
Yes, thank you very much that you came and spoke to me about this. Actually, Mr. White is having a diagnosis of post myocardial infarction depression. Did you hear about this term before?
What is this term name?
It means that he is suffering from depression and depressive symptoms after he has diagnosed with myocardial infarction. And this diagnosis affects almost 20% of cases of myocardial infarction.
Okay.
Am I clear?
Yes, yes. Well,
Okay.
well, can be there any other reason for his low mood?
Oh, yes, actually, there may be a lot of reasons, just like adjustment disorder, if he had gone through any stressful condition lately. Maybe he is suffering from depression from the beginning before he had the myocardial infarction, and maybe this is a relapse of depression he got from the beginning.
Okay,
Um, but
what?
because
Yeah.
Yes, please tell me.
Okay, so can myocardial infarction? How can myocardial infarction cause depression? I don't understand.
Yes, actually, the main cause is not clear, but the possible reasons may be that when myocardial infarction is there, cortisol hormone is raised, and this can make symptoms of depression clear, and maybe the patient will feel hopeless or helpless because of his symptoms of the myocardial infarction, and
I
that
see.
can lead to depression also.
Can depression cause myocardial infarction?
Yes, absolutely yes, because depression can activate the sympathoadrenal system, and when it is activated, it can cause myocardial infarction. And it can the sympathoadrenal system can make inflammatory proteins, and if the body is in state of platelet aggregations, it can also make myocardial infarction.
So how can we help him then?
Okay, first of all, before talking about helping Mr. White, um, I have to be sure that you are clear in some points we discussed now. That Mr. White is suffering from post myocardial infarction depression, and it may be caused by the myocardial infarction itself, or maybe relapsed from other from depression from the beginning, and myocardial infarction can cause depression, and depression can cause myocardial infarction. So
Nice.
we need to know his history of depression and the medications that he is on and he is taking, and about his social life and his lifestyle stressors. So when am I clear?
Yes, yes.
Okay, so how can we help him? First, we will make sure that we will meet Mr. White in the clinic as soon as possible, and every time we will make sure that he is attending the clinic, and if he is not shown in the clinic, we can make home visits to make sure that he is fine. And what about investigations that will be done for him? We have routine investigations that are done for all patients, like blood chemistry, liver function tests, kidney function tests. But with his condition, we have to make sure that his coagulation profile is fine, because sure, he will take antidepressants medications for his condition, and these medications can cause some change in the coagulable profile of the blood. Are you following me?
Yes, yes.
Okay, and we will have team to follow him up physically, psychologically, and socially. Physically, I will contact with the cardiologist and the general practitioner to make sure about the medications he is taking for his heart condition.
1 minute.
And antidepressants is the most important treatment in his condition according to the guidelines, and specifically SSRIs, sertraline by name, according to the SAD Heart study. And it's better to avoid some medications like tricyclic medications and venlafaxine, because they have some negative effect on heart. Are you following me till there?
Yeah. Okay.
And about the social services, they will communicate with his work to make sure that his treatment duration will not affect his work, and the occupational therapist will make sure that his work is suitable for his medical condition and physical health. And if he wants to healthy lifestyle, and he will need to follow up with a dietitian, and if he has any problem.
Time.
Okay.
Excellent. But you need to, very important, to be more fluent. As I said,
Yes.
time is wasted in the way of talking. In every sentence, you will lose 2 to 3 seconds. You don't imagine. You cannot. Can you imagine the time at the end of the station wasted in the way of talking? You needed not less than 30 seconds to just talk about the CBT, the details of the
Yes.
social intervention. So I feel that you know them, but unfortunately, because of the way of talking, you must be fluent. But this is something which is achievable if you are practicing regularly. You will find
Yeah.
that what you are saying is
Doctor, your sound is so far.
okay. If you are practicing regularly, you will find that this problem is solved without any problem. Okay, so I will go through the notes, and please read the voice from your laptop. I don't know what's the problem in my laptop today. Okay, so let's see. This. Okay, so let's go through this patient. There is another scenario. However, the outline is the same. So in the other scenario, we'll meet a patient, or your patient will be a teacher who is 53 years old with a demanding job. He has a chest pain of 8 months duration, and heart attack of 3 weeks duration, depressive symptoms of 7 months duration, and he is smoking and no exercises and drinking beer. and he's not following up on the rehabilitation program. So please read the note properly, because sometimes they give you some information regarding his lifestyle, and they expect from you to manage this problem. Okay, your introduction was very good, and your explanation was very good also. Um, could there be any reason for this low mood? Just don't say there are a lot of reasons. Also, you said a lot of reasons. Don't say these words which are not accurate actually. Also, only you can have other two differential diagnoses. If you have a lot of differential diagnoses, this means that you don't understand the condition of the patient. So
Okay.
you have adjustment disorder or relapse of his depression. But because there is a close temporal relation and the high prevalence, most probably it is the post. How can MI cause depression? This is a common question. I don't know if, as far as I know, the answer is not present. Note other notes, so you can have a screenshot from this note in front of you. MI can cause depression because of the cortisol, inflammatory chemicals, which increase the chance of having depression. Also, there are contributing psychological factors like existential factors, feeling helpless and hopeless and unable to enjoy the life as before. So these are factors which contribute to the occurrence of depression after myocardial infarction. And this is a question. There is another question which is more difficult, and definitely I didn't see any notes who have the answer for this question. Can depression cause myocardial infarction? If someone is having depression, does this fact make him more prone to develop myocardial infarction? Yes, because of some factors like associated sympathoadrenal hyperactivity. And you can say this term, it is not considered a jargon because you are talking to a medical student. Okay, sympathoadrenal hyperactivity, the platelets are activated in those who have depression, and also their inflammatory proteins, and myocardial infarction, myocardial ischemia, in reaction to stress is more in those who have depression. Okay, the question can depression cause is you will not find.
Your voice is not clear, Dr. Hussein.
I'm trying to raise my voice. I don't know what's the problem. I'm trying, really. I'm raising. I'm shouting. Actually, I'm shouting. Okay, so now your formulation was, you should have been more fluent. The formulation is a simple skill, but you must demonstrate it in the exam. It is a very simple skill. In short, you should talk about the patient's condition in 2 to 3 lines. In the first line, talk about the main psychological or main problem and the level of risk. In the second line, you are going to talk about all the background information, the information which you already know or need to know in the biopsychosocial domains. So here the patient is having a post-myocardial infarction depression, which carries high risk to him if he is not managed. All this in the background of having recent myocardial infarction. He is not involved in the rehabilitation program. Also, he has a history of depression and is on an antidepressant. You need to know more about his social life, and we need to know more about his life stresses. So this is how you crystallize the problem and to show to the examiner that you understand what are the points which you are going to focus on in all the story of the patient. Okay. Okay. Very important. Okay. Talking about the management, where the patient is going to be treated and what Dr. Ayara is going to do. Don't say we, say I'm going to see the patient. I will see the patient. I will talk to him. I will address his concern. I will discuss with him the reason of non-engagement. Say this. Very important. Those who say this definitely will give a better impression to the consultant. So Dr. Ayara must see her patient. She must talk with him to understand why he's not engaged. All these we are talking in general, but you want to know on practical basis from the patient himself why he is not engaged. Okay, I would like to follow up Mr. Brown more frequently in the clinic to do regular physical and mental state exam, and I will explain to him the diagnosis and his concern and what could be the possible reasons for non-engagement. Okay. Ideally, this is an outpatient clinic, outpatient for a case. However, you must say this sentence. However, if there is a high risk, the admission to the hospital might be considered. This is a patient who have depression and he also have a myocardial infarction. At any time while you are following up your patient, you might find that no, this is not working. The management plan is not working, and you might consider admission to the hospital. Okay, are you following me, Dr. Yara? So
yes.
Okay, so the first point is very important. I will see the patient, I will ask him why he is not engaged, I will address his concerns, I will explain his condition, I will explain the management plan. Ideally, he should be followed up in the clinic and at home. However, at any time, if you feel that your patient is at high risk, you might consider the admission in the hospital. Okay.
Okay.
Now the investigations. This is a very important point because many candidates forget that this patient is a myocardial infarction patient, and if you are going to use an antidepressant, this might affect the coagulation profile. So the candidates who pay attention to this definitely will give a better impression about themselves to the examiner because they understand their patient and they understand the patient's condition and his needs physically and psychologically. And if you pay attention, any patient who is having a myocardial infarction or heart problems, you must make sure that his coagulation profile is okay after giving him your medications, particularly SSRI. Your talk about the medication was very good. You only missed that the part of talking therapy, which is very important, particularly if he is the patient who you have been told in the candidate notes that he have work problems. So you must give him some CBT to make sure that he is able to cope with his stresses. Social services is very important. This part of the management is very important. And from my perspective, anyone who does not pay attention to this in a patient who have myocardial infarction and he has depression, I don't think he's going to pass. So this is a patient whose occupational needs and occupational abilities are different. He needs to be followed up in the clinic, so his work should give him some sort of space to do this. So, and also he needs some sort of healthy lifestyle. All this is under the heading of the social approach in the management. Okay.
Okay.
So let's see your performance. You did formulate, but please be more fluent. You identified everything in the findings and results. The management plan, unfortunately, well, you know, there will be a question mark. You did not. You had time, and I felt that you talked about his healthy lifestyle without details. You did not talk about the psychological support. So, well, this will be a question mark whether this would be scored for you or no. Does not pay sufficient attention to the patient's health. You did not say, I will talk to him. If any candidate who does not say, I will talk to my patient, see him, I will explain to him, I will ask him why he is not following up, particularly in this station. Those who does not ask their patients why he is not following up and why he is not involved in this rehabilitation program, I don't think that they will score this point. Point number 4. Yes. Management plan was good. You said that I will do regarding the medication for psychological and social without details, no problem. But point number 6, the appropriate psychological, which is the CBT, and the social interventions, this point will not be scored for you. Now, your communication was very good, except that your way of talking is not very fluent. And as what I'm going to say you might feel is biased with the English people, but you are going to do exam in the Royal College of United Kingdom. So you must expect that they expect from you a level of fluency in the English. They said that it is a level which is corresponding to those who can score 7 in the IELTS. I'm not sure of this information, but I think the point of language, you have 2 points regarding the language here, the point number 11 and 12. Okay,
Yes.
so these 2 points might not be scored for you. But all in all, it is very good. I felt that you need some more practice to be more fluent and more able to put all what you know about the management in the 7 minutes. Okay, thank you so much, Dr. Riara. Who would like to
Thank
go
you.
next?
I can do the next.
Dr.
Achitra.
Nawando, sorry about the sound, doctors. I don't know what's wrong with the sound, please. Sorry. Okay, who would like to go next?
I can do the next. Achitra, postpartum
Okay.
psychosis.
Okay, doctor. Postpartum psychosis.
I'm ready.
Okay, very good, excellent. So, let's say my name is Mr. Green, my wife is Mrs. Green. Okay, let's make it
Okay.
green this time. 1, 2, 3, go.
Okay.
Go ahead, start.
Hi, Mr. Green. I'm Dr.
Hello.
Achitra, one of the psychiatrists in perinatal team.
Hello, doctor. Hello, nice meeting you. I want to know what's wrong with my wife. I'm very worried about her.
Yeah, I can see you're very worried, and I can see your wife has given birth just 4 weeks back.
Yes.
Yeah, and I can see that she's tearful. I can see from the notes she's tearful, worried. Is that right?
Yes, yes.
Um, can I just ask how long have you noticed this?
Well, it has been going on after the giving birth to the child, our son, and she has been doing fine all over the pregnancy period.
Okay.
But I don't know. Now she has not been well for about 2 to 3 weeks.
Okay, I can see that you're very worried, but I can assure you that we can help you and your wife, Mrs. Green.
Okay.
And I can see from the notes that she is afraid that devil might harm her baby.
Yes, yes, exactly.
Okay. Does she tell she's hearing the voices of devil?
What?
Does she tell that she is hearing voices of the devil?
No, no.
Okay, she believes that devil might harm her. Is that right?
Yes, exactly.
Okay. And is she able to take care of herself? Is she able to take care of herself?
Well, not as before, actually, not as before.
Okay. Is she feeding the baby?
Now she's very emotional now and tearful, and sometimes, many times I hear the baby crying and she's not paying attention to him.
Okay, that's very sorry to hear. And has she ever said about any thoughts of harming herself?
No, no, no,
And is she worried that she might harm the baby?
no, no. But I'm worried that she might not be able to take care of him. That's it.
Okay, okay, I understand. Uh, and does she have any other physical health issues?
No, no.
Does she had any history of contact with mental health services in the past?
What?
Any psychiatric history, contact with mental health services in the past?
No, no.
Okay. Um, I understand that you want to know what is happening with your wife, right?
Yes.
So I can see that she just delivered baby 4 weeks back, and now she is tearful, emotional, not able to take care of the baby, not the baby is crying, and she's believing that the devils might harm, or the devil will harm her, harm the baby, and we call it postpartum psychosis.
Well, what is this postpartum psychosis?
Okay, so immediately after the delivery, when people experiences false beliefs, like she is believing that the devil will harm the baby and tearful. So she's not in touch with reality. That is what we call postpartum psychosis after the delivery. Does that make sense?
Yes, yes, yes.
Okay. Do you have any doubts so far?
No, no, no.
Okay. Would you like to know about the management plan now, or do you have any other concerns?
Well, I just want to know if there is any risk from this problem on the baby.
There is sometimes when people are having postpartum psychosis, sometimes there is risk of harming the baby. Sometimes they would be, some people would be hearing voices that might tell to harm the baby. Um, so there is some risk involved to it, but don't worry. We are here to help you and your family.
Yes.
Okay. Would you like to?
Okay. Yes.
Do you have any
How
other
are you,
questions?
what can be the cause of this disorder?
Okay. The cause, we can't tell the exact cause, but sometimes there can be family history of mental health issues, or did she had any family members going through similar situation?
No, no, no.
Okay. Sometimes there can be genetic, sometimes stressful, and also during pregnancy and post-delivery, the hormone changes can induce this illness.
Okay.
So, is there any other stresses she are going through?
No, no, no,
Okay. Is she sleeping well?
no, no.
Okay, okay. All these delivery hormone changes, not able to sleep well, these can also cause this.
I see, I see.
Okay.
So they said sometimes that there are patients who get some sort of after delivery postpartum blues. Is this the case with my wife?
Um, Usually, there are a lot of women after delivery getting postpartum blues, but it would disappear within 2 weeks mostly, and it would be mostly that when they are more emotional, but they won't be believing that devils would harm them. So that belief does not sound like postpartum blues, unfortunately.
I see, I see, I see. So how are you going to help her then?
Yeah.
One
So
minute.
uh, for immediate management, we would recommend to admit your wife and baby in mother and baby unit together, and she will be started on antipsychotic medication, olanzapine, preferably. But we need to do some blood investigations, ECG, measure her body weight and her height, is and then we will be giving after long term we'll be giving psychological support in the hospital. We'll also be giving support for feeding and taking care of the baby.
Yes,
And when she's better, in the hospital we will evaluate her mental state, assess the risk to baby and herself, and we'll also give support to you for carer support. And in the long term, when she's better, we'll give psychological support. We will monitor her in the house. The psychiatric nurse will come to the house, and we'll frequently follow up with the psychiatrist, also perinatal psychiatrist. Does that sound good?
Okay, okay.
Okay, and she'll be provided with your support group.
Time.
Thank you.
Okay.
Thank you.
How do you feel about what you did?
I think I should have started with management a little bit earlier.
Okay, so please give her some feedback in the chat section. We all of us are experienced doctors, and definitely you have your opinion, which I really respect. Let's see this. Yeah. I don't. Again, the sound is muffled. Okay, so let's see according to the to our postpartum psychosis notes. So this is a patient who is medically cleared and everything's okay regarding his medical condition, and she has a very obvious abnormal mental state after giving birth after 4 weeks of delivery. Okay, she started to hear voices sometimes in the station. They say yes, she's hearing voices, sometimes no. We do these subtle changes in the scenarios, okay? You will meet the husband, who is instructed to appear extremely worried. And this instruction is important for you as a doctor in the station, because you must show the reciprocal and the appropriate emotional state. Okay? So let's see. You will introduce yourself, you will show empathy, okay, and then you will gather the biopsychosocial information already. She doesn't have any psychological problems except which are already mentioned. You want to know more about the social support around her and the level of risk. Okay. Now the explanation, please pay attention. It is a very simple explanation, but don't try to use jargon. The problem in the explanation is it challenges your ability to simplify the explanation. Are you able to explain any medical problem in simple words or no? Okay. So the postpartum psychosis is a mental problem in 1 to 2 every 1,000 lady, and usually 2 weeks after the delivery. Okay. What could be the cause is a very common answer, and the question and the common answer is that no particular cause. Some factors increase the chance of having this disorder, like past family history, having a past medical mental problem, first pregnancy, complicated pregnancy, delivery, and very young or very old women when pregnant, sleep deprivation, and also hormonal and chemical imbalance. Okay, this is the answer for this question. Let's see. What is the difference between the postpartum psychosis and postpartum blues? Again, you will not find this answer in the notes, which is available in your hands, so you can write down the answer. The postpartum blues is a common psychological problem which happens up to 50% of the ladies, and usually happens within 5 days. The main symptoms are emotional lability, difficulty in sleeping, and anxiety, and resolves after 2 weeks. So it is usually absent after 2 weeks. That's why in the candidate notes they gave you an information that this condition has been there for more than 4 weeks. Okay. I hope that you could have formulated in a better way. Now, when talking about the management, always say, what are you going to do, doctor, and where the patient is going to be treated? I didn't hear from you that you are going to talk with your patient and to explain to her condition and the management plan. And you must say that this patient, for safety concerns, she should be in the hospital. There are safety concerns regarding her and her baby, okay, the mother and baby unit. As long as you are going to give medications, don't talk about the medications before talking about the investigations. And then the team, the sacred sentence, there will be a team which will for up here we have a perinatal team. Also, there is a sacred sentence which I will follow up my patient myself, see her and talk with her. All these sentences which give a good impression to the examiner. Now, the backbone of the management here is the antipsychotic, which is safe for the breastfeeding. You must say this, that you are going to give her a medication which can help her breastfeed her son or breastfeed her baby. Okay, also the talking therapy will help her to control the negative thoughts. If there is no improvement, you must talk about the sequence. If there is no improvement, you might consider the ECT. Okay, now please pay attention to this. If you want to show that you are an experienced doctor and you are fit to have the label of a membership of the Royal College, pay attention to this. If you are going to take the decision of admission of the patient for any whatever condition or whatever reasons you are going to admit the patient, you must also talk about the condition of discharge. Okay, she or he will not stay in the hospital forever. So here we have a lady who has been admitted to the hospital for particular reasons. Now you must talk about what could be the possible condition for her when she will be discharged here. If her mental state is stable and it is safe to be discharged, she will go back home and will be followed up by a nurse to make sure that she and the baby are safe, and also to detect the early sign of any physical or psychological problems. Okay, are you with me, doctors? I'm telling you what to say to show that you are different from the other candidates, to show that you are up to the level of being the member of the Royal College. Let's go through this mark sheet rapidly. The mark sheet. She did formulate the problem effectively. She did recognize significance of finding a result. The management plan could have been better. So this point might not be scored for her. I didn't hear from her that she is going to talk to her patient. So point number 4 might not be scored for her. Risk management, she did pay attention to by staying in making the patient admitted to the mother and baby unit. The psychological and social interventions, she didn't talk about any of them. So this point might not be scored for her. I felt that you could have been more fluent. So the point number 7, because you did not finish in the appropriate time. So this is a poor management of consultation, and you are not very fluent in your language. So point number 12 might not be scored for you. Again, this is not a pass or fail. It's just to help you to understand how you are going to be assessed, what is expected from you, and how to use this mark sheet. It is a very important tool in your preparation. Please never revise without using this mark sheet with your colleagues, okay? Who would like to go next?
Thank you.
Thank you so much. Who would like to go next?
I'm happy to do the schizophrenia. I know I've already had a station, but if no one else wants to do it,
no
I'm
one
happy
to do the stations, no problem. If you want to have more than one station, 2 stations, no problem.
Thank you.
So what is your station which you want to do?
Schizophrenia with cannabis use, I think.
Yeah, okay.
Yeah.
Can we just scroll up?
Mm-hmm. His name is Martin. Yeah.
Yeah.
Okay.
Okay. So
Yeah, I'm ready. Yeah.
I'll set the time in 1, 2, 3, go.
Hello, Martin. I'm Dr. Yusuf, one of the psychiatrists with the mental health team here. I understand GP referred you to speak to us about your current difficulties. How can I help you today?
Well, yeah, I'm starting to hear these voices again, and I discussed this with my GP. He said that I must talk with you.
Hmm. Oh, that must have been distressing. What's been happening? What voices were you hearing?
Well, sometimes I hear the voice of my neighbors, sometimes the voice of my ex-girlfriend. I'm not
Mm-hmm.
happy with them. Sometimes I feel that they are real. Sometimes I know that they are part of my illness. But I'm confused.
Okay. And what are the voices saying to you?
Well, nothing specific. Sometimes they are calling my name. Sometimes they are talking with each other. Nothing
Mm.
specific, doctor.
Okay. Did they ever ask you to do things or perform actions?
No, no, no,
Right. Did they ever threaten you?
no, no.
Right. Okay. And how long this been going on?
Well, it started about maybe 2 to 3 weeks ago.
Okay. What about before that? How were you?
Everything was fine.
Okay. So about 3 weeks ago, these voices started again. Has anything changed in your life in that period?
Well, I stopped the medications. I was not happy with them. I did not feel that they are suitable for me.
Okay. What makes you stop with anything specific?
Well, it's just something, well, sensitive, doctor, so I'm
Mm,
not sensitive to talk about.
Okay. Well, I want you to know that everything that you share here will be confidential, and I'm happy to support you, even if it's sensitive. It would be very helpful to let us know what's going on so we can support you.
Well, it's you can see it's affecting my relation with my girlfriend. It's not making it affects the erection, as you know. These medications not good in things, so I stopped them.
Right. Okay. And how long that's been going on?
Well, about 2 weeks ago.
Okay. And so the voices started after you stopped your medication, and it's your girlfriend or your neighbors just talking about you, not
Yeah,
threatening. And is this getting worse?
yeah. With time, I feel that it is more and more, and sometimes I feel that they are after me, and
Hmm.
I'm confused. Sometimes I believe these thoughts, and sometimes I don't. I don't know, doctor.
Okay. Do you feel anyone is controlling your thoughts?
No, no, no.
Okay. All right. What about your mood?
Well,
How has
as
it
I
been?
said, I'm not happy. I'm not. I'm frustrated. I'm down, but I'm
Mm,
not depressed.
okay. Have you found yourself, coping with these voices by drinking more alcohol?
No, I don't drink alcohol.
What about using illicit drugs?
Yeah. Cannabis makes me feel better, and I'm using it more nowadays.
Okay. Roughly how much are you using?
Maybe 5 to 6 cigarettes a day.
Okay. Has these events, the voices and everything you're feeling and your mood changes, has that ever made your life feeling life is not worth living anymore?
No, no, no.
Okay. Well, thank you so much, Martin, for sharing all this information with me. It appears that your diagnosis of schizophrenia has relapsed, and this looks like has been affected by the stopping of medication and your increased use of cannabis. How do you feel about that?
Well, yeah, it's something like this, yeah. Because it happened before, but you can see the medications are not very good. I'm not happy with them. So
Mm.
how can you help me?
Okay, that's really good questions. But before I start talking about how I can help you, I would like to highlight the most important points that would help me formulate a management plan. Is that all right with you?
Yeah,
So,
yeah.
so it seems that you're having a relapse of your schizophrenia symptoms, and this is on the background of restarting taking cannabis and stopping your medication. And if this is not managed well, unfortunately, there is a high risk of to your well-being and safety.
Yeah.
Yeah. So what I'm going to do is in terms of the management plan, I would like to regularly set up reviews to see you in my clinic to monitor your mental health. The other thing I would like to do is to order investigations, especially blood tests like full blood count, liver function test, kidney function test, and most importantly, I would like to check your blood sugar and your prolactin level, because that could be affecting the sexual health.
Yeah, okay.
Yeah. After that, we have a multidisciplinary team that would looking after all of your psychological, physical, and social needs. Is that so far so good?
Yeah.
Are you happy with that?
Yeah.
After that, of course, we will have to look
1
into.
minute remaining.
We will look into putting you again on the olanzapine, because that has
Well,
worked
I'm
really
not
well.
happy with this medication. It's affecting me, as I said, so I'm not happy with it.
Yeah, I can see where you're coming from. However, because olanzapine has controlled all your symptoms well over the past 5 years, we could add a medication called sildenafil that would help with the sexual side effects. So that's one option we could do. If that doesn't work, we have another medication, which is an antipsychotic called aripiprazole, that does not it does not cause any sexual side effects. How does that sound to you?
Yeah. This can be better.
All right. Okay. And of course, I will not forget to support you socially, because I can see you're struggling with cannabis misuse. I would like to refer you to the drug and alcohol services. How do you feel about that, Martin?
Yeah, no problem. Right.
Yeah.
Very
Thank
good,
you.
very good. Yeah, I think you covered every point except that you should mention the talking therapy. Everything was fine in your performance. I don't have any comments. You asked about everything. You assessed you addressed the two parts of the task. Now, this is a two-task station, which can be a bit difficult because the candidates will be confused. What are the levels or the cut points of the history taking, and what are the cut points of the amount of management in the station? So you might feel that it is an easy station, but actually it is confusing for the candidates because they want to know exactly what is the extent of history taking and what is the extent of management in this station. Let's see according to the okay, so as you can see, the task here is to brief history and formulate a management plan. And actually, this is what you did. You assessed the complaint, which is the main part. Want to know exactly the onset and the course, and how was he doing or before the onset. This is the main part of the history part, the complaint. You want to know exactly when did it all start, how did it start, and the course. If he is feeling that it's increasing with time, anything makes them more them more inclined, those who are persecuting him, anything prevents them from doing this. Okay, so you want to know the cause before the onset. How was he doing before that? And you will discover that everything was good, except that he decided to stop his medications. He will not voluntarily tell you more details about the issue of erectile dysfunction and cannabis. You must dig to find these important points because they are spared for the good candidates. And now we want to know more about the symptoms of the syndrome. Now, he is already diagnosed with schizophrenia. All I want to know is to establish that the symptoms are flourishing and he is in a relapse. We don't want to take a full history and to all diagnostic criteria of schizophrenia. Just demonstrate that he is in a relapse. Okay?
Mm-hmm.
Now, very important to understand his social part. The social part, the stresses, and anyone around him. If he has any medical problems, and then the level of risk, as I said, it is very important to make sure that you cover this important point in the management plan, because as far as I know, no one will pass the management station without demonstrating that he is a safe practitioner and he is keen to make sure that his patient is safe. Okay, so this is regarding the history part. You explained the condition in a very good way. You did your formulation very good. And you covered the management very good. He is going to be followed up in the clinic. Everything regarding the management was good, as I said, except for the talking therapy. Very good, very good. I don't have any comments. Okay, thank you so much, Dr.
Thank you. Thank you.
Who would like to go next? Anyone would like to go next? Yeah, anyone wants to do another station, no problem. Okay. Thank you so much. And I'm very sorry for the voice problems. I hope it will be corrected while I upload the videos. Just raise the volume. And thank you so much. It was a pleasure and a privilege. Thank you so much, doctors. Have a good night.